Hello, I'm Ralph Peterson, the founder and CEO of the Standard Health and Rehab. The Standard Health and Rehab is a training center like no other training centers. Here, we focus exclusively on teaching administrators and their executive housekeepers on how to run the most effective and efficient housekeeping and laundry departments in their nursing home. You attend one of our 3-day workshops. I guarantee you will learn everything you need to know on how to design, manage, and implement the most effective and efficient housekeeping and laundry program that adheres to the CDC guidelines. Everything we do is based on the CDC guidelines. Job routines, creating all our schedules, cleaning all our cleaning processes, and then this wonderful thing that we do on day 2 is we have a fishbowl where it's called a fishbowl. It's not an actual fishbowl, but because we're doing it video-based, because we're doing it on a Zoom call, I give everybody the opportunity to share their own facility map. And so somebody will come in with a 240-bed facility map, and we'll put it up on the fishbowl on the screen so everybody can see it. And then one-on-one, we'll dissect it. We'll break down all the rooms. We'll talk about rooms, cleaning schedules, how often, what direction housekeepers should go, where to divide the workload from this housekeeper works till here, this housekeeper works till there. And it is literally, everybody gets to watch us take apart a 240-bed nursing home. And then somebody else will come in and they'll be like, I have a 50-bed nursing home, but it's a little unique, and we do this, we do that. I'm like, let's throw it up in the fishbowl. And now everybody's looking at that home facility map, and we're dissecting that. We're talking about where these job routines can go, and how this job routine can go, and how to clean the front entrance, and how often to clean resident rooms, and what about the public bathrooms. And we just literally dissect all these facilities, and everybody that's part of the standard, they all get to watch in real time, and everybody gets to ask questions and put input, and you walk away just having such a bigger, broader understanding of what it's like to clean and dissect a building, to clean it properly, day in and day out. I'm telling you, you do not know the value. You wouldn't understand the value that it provides just watching how we clean. You ever dissect an 800-bed facility? I have. It's a lot of work, but it is so fascinating. And if you're running a 100-bed building, a 200-bed building, trust me when I say, watching us take apart a 50-bed building, a 200-bed building, an 800-bed building, even though you're only running a 300-bed building or you're only running an 80-bed building, it is so super valuable. You'd be able to go back to your facility and go, okay, now I understand. Now I'm seeing the big picture. Now I'm able to understand how I'm supposed to be even just addressing this building and cleaning it on a consistent basis. Our mission is to provide a clean, safe, and sanitized facility for our residents and our fellow coworkers and our visitors. That's what we want to do. We want the place to look beautiful, and we want it to be completely disinfected on a consistent basis. It takes a plan, it takes a process, it takes time, it takes effort, it takes a structured plan